As the Thanksgiving rush is underway, coronavirus infections are unfortunately skyrocketing across the country. Over the weekend, the U.S. topped 12 million cases. More than 3 million of those infections were diagnosed in November alone. Meanwhile, over 255,000 people have died as a result of the virus. This is all according to Johns Hopkins University. But there is a glimmer of hope in the fight against COVID-19. 2 vaccines, now in late-stage testing, could bring the pandemic under control by spring. Pfizer and Moderna both say that their doses are more than 95% effective against the deadly disease. Pfizer applied for FDA emergency use authorization on Friday. Moderna is expected to do the same thing in the coming weeks. And across the pond, AstraZeneca announced that its experimental coronavirus vaccine is up to 90% effective, depending on the dosage. But the nation's top infectious disease expert, Dr. Anthony Fauci, warns the success of these vaccines all depends on the number of people that actually get the shot.
If you have a highly efficacious vaccine and only a relatively small 40–50% of the people get vaccinated, you're not going to get the herd immunity you need.
Meanwhile, the FDA has granted emergency authorization for the COVID-19 antibody treatment that was administered to President Trump shortly after he was diagnosed in October. The company behind the cocktail of drugs says that it could have enough doses for around 80,000 patients by the end of November. And this all comes as millions of Americans ignore COVID risks. They pack the airports to fly home for the Thanksgiving holiday. Bofta Yimam joins me now from Washington. Bofta, all this traveling comes after last week's dire warning from the CDC, begging people essentially to stay home or take the chances of unknowingly inviting the COVID vaccine to your Thanksgiving dinner. Oh, not the vaccine, the virus.
Right. Anne-Marie, good morning. And you're absolutely right. Folks have heard the warning, but they're ignoring it. They are determined to see their family. 50 million Americans are planning to travel for Thanksgiving, and experts warn that crowded airports could lead to a spike this winter. Still, folks are determined, as we have been saying, to see their family. They're probably packing their bags right now as they're watching this, and they are determined to see their family and eager to spend time with them after months of social distancing fatigue.
There's a lot more people here than I thought would be here.
Many Americans aren't letting the coronavirus stop them from traveling for Thanksgiving.
I'm 64 years old, and I just want to enjoy what we can enjoy while we can.
More than 2 million people passed through TSA checkpoints on Friday and Saturday. AAA expects 50 million to travel in some form this week.
I just don't want to risk it at all.
Peyton Udo won't be one of them.
Video chat my family as well, because I wish I could be with them, clearly, and they really want me to come home, but I had to turn them down.
Dr. Anthony Fauci says Americans should stay put.
You see the clips on TV, people's at airports. I mean, those are the things we've got to realize are going to get us into even more trouble than we're in right now.
A record 83,000 Americans are currently hospitalized with COVID-19, and cases are on the rise in most of the country.
And we know travel just is like embers spreading it, and it's like somebody carrying those embers in a plane.
Dr. Monsef Slawi is chief advisor to Operation Warp Speed, the federal government's coronavirus vaccine development program.
Most people need to be immunized before we can go back to a normal life.
He hopes at least 20 million Americans will be vaccinated by the end of the year if the FDA approves an emergency authorization next month.
On the 11th or on the 12th of December, hopefully, the first people will be immunized across the United States.
Experts say healthcare workers and the elderly should be the first to get the vaccine.
So, Bofta, we've been talking about this new vaccine across the pond, this University of Oxford developed vaccine, which is also in conjunction with AstraZeneca. What do we know about it, and could we see an approval soon?
So what we know right now, Anne-Marie, is that it hasn't been approved by regulators, including the FDA, but they hope to start talks with the FDA very soon, potentially even this week. The good news about this vaccine that we want to share with everyone at home is that it's up to 90% effective, depending on the dosage. They do expect that this will be a 2-dose vaccine. We do know that around 20,000 plus were involved in this trial, about half of them maybe even receiving that vaccine. They've been been working on this for the past 10 months, so this is not something that was done within the past few weeks or even several weeks. This has been released since about April. So we know that they've been working hard on this. As you mentioned, a partnership essentially between AstraZeneca and the University of Oxford. One thing to point out is that it's said to be cheaper potentially than the other two that are right now possibilities, and also potentially more global access. That's a little bit easier because of the way that it can be stored, a little bit easier storage with refrigerator temperatures, they're saying. So that's all promising when you're trying to get this to different countries all around the world. And the UK has apparently already pre-ordered 100 million doses. Anne Marie.
Wow. All right, Bofta, thank you so much.